medical tourism family, to everyone who carry health from people from all over the globe. And today we will speak about hair transplantation. Extremely interesting topic, very modern and very popular nowadays. And today my guest is from group of clinic Direct Hair Implantation DHI Technique from India. They are winners of 2 awards in 2 nominations in European Medical Tourism and Wellness Awards in 2024, launched from BookingSmith platform. And DHI is a world's largest and fastest growth chain of hair transplant clinic. It is 70 clinics present across 45 countries. It's a group of clinics that not only treat but also develop innovative technologies, methods, and train specialists from all over the world. If someone don't know me, I'm Natalia Strokovska, proud supporter of global medical tourism and founder of DoctorGEO&SPA tourism agency, consultant and co-organizer of many international events. And I would like to invite my guest, one moment, and also Dr. Kuntal. Please join. I sent you a request to join me. Hello.
Hi there. How are you?
I'm fine. So waiting for second hour participant.
Yes, I think we are going to be joined by Mr. Bansal very soon.
Okay. So let me introduce Dr. Kuntal Deb Barma, correct? This
Yes.
is a renowned hair transplant surgeon and medical director of DHI International. And we are waiting for Ajay Bansal, medical director and CEO of DHI International company. So asking for request, someone, one moment. No, I don't see request. Dr. Ajay, please send me request. Maybe I can do like that. DHI International. I sent again. Please join us.
Yes, I think they're going to be joining us very soon.
Yes, great. So, welcome to Ajay Bansal, Managing Director and CEO of DHI International. Hello.
Thank you very much, Natalia, for having us on your show.
Thank you. Welcome to both, and congratulations of winning in the 2024 European Medical Tourism Award. And my first question to Mr. Bansal, what does this recognition mean for DHI International?
Thank you, Natalia. DHI Medical Group has been focused on only one thing in the last 5 decades, and that is doing highest quality of hair transplant procedures. And this is a great recognition for DHI International. It is a great testimony to our focus on customer satisfaction, patient safety, and great results. I'm aware that there were many entries from other hair transplant clinics as well as aesthetic clinics from all across the world. DHI International operates in 45 countries, and we have fantastic clientele all over the world. People trust us, and this award really is an affirmation of the trust that patients from all over the world have placed on us. So we are delighted, and it is a great encouragement for all the team members of DHI to do even better.
Good. My congratulations again. And my questions, and hair transplantation is probably one of the 3 most popular cosmetic procedures in the world nowadays, correct? And you're operating successfully in 45 countries, as you say. And who is your client? And are you mostly treating local patients who come into your clinics, or you also accept international clients?
Okay. So let me talk first about the three main cosmetic procedures you spoke about. You're absolutely right. Hair transplant, uh, dental treatments, and skin and aesthetic treatments. These are the three topmost treatments in the world today. And there was a research done by ISHRS a couple of years back, which showed that hair loss causes the most severe distress to the patients as compared to a crooked teeth, let us say, or having uneven skin tone or something like that. Okay, so I'm very happy that our company is able to treat the patients in an area which really troubles them a lot. And yes, as you rightly said, we operate in 45 countries successfully, and I would give the credit for the success to the fact that our values are something that we adhere to in everything we do. Okay, so education, innovation, and transparency. These are the three values that we have totally embraced in every aspect of our life, if I may say. Okay, not just our work life, also in our personal lives. It has become a way of life for us, and that is how we treat our patients. And you'll be surprised, our customer satisfaction rate is more than 99%. It's close to 99.8%. Okay, and we take great pride in this thing. And yes, on the second part of your question, which was about whether the patients are local or international. Look, I mean, the boundaries and distances have blurred a bit, over the years. Now, hair transplant is a very important decision. It is a very important procedure for somebody to choose to do, and people are willing to travel today. If they find that there is a great treatment available in some other country, they're very happy to actually book a ticket and take a flight. If you ask me, out of thousands of patients that we treat every year, probably 15% or 20% would be traveling patients.
Mhm.
And we take great pride in it, that even where we do not have clinics, people are coming in from there. And that gives us the motivation to open more clinics in those territories, which is why we are also the fastest growing hair transplant company in the world.
Cool. Thank you. Thank you. And I would like to ask our audience, if you have some questions, you can write this question in the chat, and our guests, our doctors will answer with pleasure. And my next question to Dr. Kuntal, I'm sure you speak with patients a lot, so Dr. Basil
Yes.
already answered a bit, but in your opinion, is hair or eyebrow transplantation, is this fashion trend, or does it procedure really change in life of people? What do you think?
Uh, I, yeah, I wouldn't say that this is just a fashion trend per se. This is actually a procedure which changes lives. And in our day-to-day practice, in all our clinics all over the world, we see a lot of our patients, our clients who come to us who are under a lot of emotional stress and turmoil. They are facing rejection in personal life. They don't have the confidence to go out, look for a job. We see so many young people in their early 20s who suffer from a great deal of hair loss and they cannot go out and they actually suffer from depression. So it's not just them, it's their loved one, it's the families, the parents who come to us along with that. And we chalk out a proper treatment plan for all of them. And we do it in such a way that it can not just reconstruct their hair, their hairline, and give them back the hair that they once had, but it also transforms them in terms of their life goals. They become so confident after 6 to 9 months when the results come, and it not just changes their look, but also their life, their entire being, their confidence, career, everything. And that is actually the biggest motivating factor that we have. And that's why I feel, more than a fashion thing, it's actually the aesthetic procedure which changes life or transforms life the most.
Great, like psychologist. So, and how complicated this procedure it is, and what the procedures you take, for example, especially for international patients. And from
Yes.
my personal experience, I talk with, for example, Korean plastic surgeons, and they say to me there is different approaches in surgery between different nationalities, and because type of skin different. And
Yes.
is the same challenges for hair transplant surgeon? For example, with hair of Arab men's black hair and Irish
Yes.
men red hair.
Yes.
Please tell me.
Yes, yes, it is actually because every one of our all of us with different ethnicities, we have a specific characteristic of the features, the type of hair. So all of them, and not just that, even in cultural tradition, also they do want a hairstyle of a particular kind. So because we have clinics all across all the continents and more than 45 countries, we have a vast array of clientele from different ethnicities like Caucasian, Southeast Asian, South Asians, Asians, and even blacks. We have clients from all over the world, across the continents, doing in different countries. So, based on them, based on these experiences, we basically ensure that each person who comes to us, we do a lot of evaluations. It's not just about hair transplant, because first and foremost, we do the psychological evaluation, and then we do the characteristic features of their face, which is the aesthetic part. And then we also ensure that a proper dermatological examination is done because various ethnicities might come with their own set of problems. So we ensure that these are not there. And also mathematical evaluation because based on their ethnicity, like for example, you mentioned about an Irish gentleman with red hair. So they are someone who have a very thick hair. They have a lot of multiple roots. That is something which gives its own set of challenge, and of course the contrast is less because the white skin and the fair or the blonde hair kind of is something which poses a lot of challenge vis-a-vis someone maybe from Southeast Asia or with an Asian ethnicity where the hair type is very thin. So based on these, we use specific instruments which helps us extract the best possible roots out of them and give them the best possible result. And also the hair line designing, the type of hair density that we give is also variable in these kind of ethnicities. So again, because of the vast experience that we have serving across all these countries, it actually is something which we do a lot often.
Who is the best client for you? From which country? For easiest to do hair transplantation?
Uh, More than a country, I would say it varies from people to people. Every country has good people and not so good people. So it's the individual more than the country. For us, like I said, each country, each ethnicity has its own challenges, but we are more than capable of meeting and living up to those challenges.
So any European, any American can come to you and you will fix all
Yeah,
problems.
we do. I would say around 10% of the people that we cater to are someone who flies from the US, from Europe, across all our clinics.
And Dr. Kuntal, would you like to also touch upon the Afro hair, which is considered to be
Yes,
fairly
yes,
unique, and how we have been
yes.
very successful with that? Yeah.
Exactly, exactly. So, I mean, you asked about the easiest one. I would say the most challenging one, of course, is the Afro hair because they have got curly hair and the hair root is comma shape. It's like a C inside the skin. So, taking them out, when we take out the hair, there's something known as transaction where the hair root gets cut. So, in terms of that, the Afro hair is very challenging, but we have special instruments, special punches
Oh,
that are patented by us, and using them, and of course the vast experience that many of our surgeons have of treating those kind of afro hair, we can actually give a full scalp coverage even in afro hair. I mean, someday hopefully we can share pictures of our afro transformations, and they're brilliant. And also we have afro clients not just in India, but we get a lot of these in the Middle Eastern countries, in the South American countries as well. And so all of our clinics are well equipped in doing those kind of cases with
so
tremendous success.
good. This insurance, you say it is insurance for doctors, or this insurance can take client, I mean even foreign client also.
Yes, yes, because all of our doctors, they undergo a specific training program. Every surgeon who does procedures in DHI, by the way, it's only in the DHI organization where every single procedure is done only and only by doctors and not just by technicians or nurses and all. So they are well trained in catering to different kind of clients from different ethnicities. They have experience of years before they can actually start doing sessions independently. So all of them are equipped in handling any kind of situation, any kind of client.
Good. Good. We have questions from audience and to whom in concern. How do we ensure safety and success in our hair transplant procedures? Who can answer?
Yeah, I would like to take that. In terms of safety, of course, we have specific protocols. We have specific pre-operative instructions. We have particular blood tests that need to be done, the dermatological examination that you have already mentioned. People who are uh, patients of, say, hypertension, who are diabetic, and who have hypothyroidism, we ensure that these parameters are taken care of, they are under control. And we also have a board of plastic surgeons, dermatologists, and anesthesiologists who do take care of these cases. If at all there is any complication previously, we ensure that on the table, when the person is there, every single parameter is met, and the person who is undergoing a DHI hair transplant procedure comes out of it absolutely safely, and he can resume his day-to-day activities in a day or two. I'm happy to say that in the history of DHI, there has not been any single complication of anyone having even a small infection, leave alone any severe complications. So that is all the duress of the entire protocol that not just the medical team, but also the clinic team undergoes. And in every clinic, we have one particular individual whose work is to go through the safety protocols of that clinic on a day-to-day basis. And even for individuals who come from abroad, maybe from the US, maybe from Europe, we have a licensing officer or a person from the clinic who takes care of their preset of blood tests and the procedure and even post-transplant. So every single thing, not just the transplant, but also in the future for the next 1 year, right from his or her recuperation and maybe the results coming up, every single thing is taken care of. So that's how much we go and work in detail.
Thank you. And my questions about Bansal, and also we have questions in the chat about technologies. Which technologies do you use in DHI, and what I'm facing, me personally, that people, for example, in Turkey, it's too popular, and even they started to use some robotic technologies. They do all transplantation themselves. So people without medical education use it. And after that, well, people had a problem with their follicles. It's not renovated again. So, and it is new transplantation impossible. So please explain what is the newest technologies in the world and what do you use?
Okay. So if you were to ask ChatGPT, what are the techniques of hair transplant in the world, it will tell you there are three techniques. One is FUT or a strip method, which has been the most conventional method of doing hair transplants. So before that, I will say that hair transplant, if I was to explain in very simple terms, it is extracting hair from the back of the head and implanting it in the front of the head, which is where you typically lose hair. Okay, so two steps: extraction and implantation. I'm reducing it to a very simple equation. Okay, now in the strip method or FUT method, the extraction of the hair from the back of the head is done by cutting a strip of skin. It to take it out of the scalp, a strip of skin, and then you cut it, and you take out hair, and then you implant those grafts in the front area. Now this is a very, very invasive method, and obviously it can lead to medical complications. Not only that, because there is a very severe handling of grafts, hair follicles in this method, it can lead to a lot of loss of hair grafts. So the survival of the implanted grafts is a very big question mark. Okay, but still there are many doctors who do it. The second method, which is called follicular unit extraction method, FUE method. In this, the hairs are extracted one by one from the back, and then in the front of the head, some certain slits are created, okay, with scalpels, and the follicles are inserted inside those slits. Okay, so this is how typically, implantation and extraction is done in FUE. Now, FUE is a better version, so to say, than FUT. But having said that, it has many of its own issues. Okay, it does leave some scarring. It does take some time to heal, and the results may not be as natural. And I will explain to you why when I compare it with the DHI method. The third method, which ChatGPT would tell you, is DHI, which is our unique and patented method. DHI method is where the hairs are taken out one by one using specialized instruments, and they are implanted one by one using specialized instruments. Now, these instruments that we use, they ensure that the hair transplant surgeon has a perfect control over the angle, depth, and direction of the hairs that are being implanted. Okay, so we are able to give the right kind of density, we are able to give the right kind of angles and directions, and it perfectly matches with your other existing hair to give you a beautiful, natural looking result. The viability of the grafts, the survival of the grafts that are implanted is more than 90% in all the cases. Okay, I'm not talking about one or two rare cases where there could be other medical issues, but the survivability of the grafts is fantastic. So the results are simply awesome. Okay. Now you asked me a question about Turkey, and you're right. Turkey is a beautiful country, and they have promoted, a lot of doctors there have promoted their clinics as the mecca of hair transplant in the world, and they offer cheap packages where you can go and have a holiday in Istanbul, and do a hair transplant, stay in a hotel for a couple of days, and then come back. uh, you know my only advice to those people is not to mix a hair transplant surgical process with the pleasure of tourism.
Really?
Okay, these are two different objectives. Okay, hair transplant is a serious business, and they offer such cheap prices. Now, unfortunately, because of these cheap prices, how do you achieve that? Because you have to cut costs. So many of the clinics in Turkey, and no disrespect to to the industry at large, there are some fantastic doctors there also, but by and large, what Turkey is known for is those clinics where it is like a factory setting where there are a lot of people being operated on in a row, and on every patient there will be 4 or 5 technicians working, okay, simultaneously taking out the hair, okay, simultaneously trying to implant, or somebody is extracting, somebody is implanting, which means that there is actually no design, no hairline design they have in mind. Okay, they don't have a treatment plan. Okay, without a treatment plan and without a design, imagine how the implanted hair is going to be. Okay, so the survivability of the grafts is an issue, and also even if they survive, the naturalness of the result is a very big question mark. Having said that, I mean, the other issue is on the safety protocols. Okay, in many of these clinics, safety can be compromised. Okay, so my advice to people is not to please mix tourism with with the hair transplant procedure.
A lot of people
Ask me a question
like
about
that.
yeah, this is a serious thing. I mean, come on, this is a life changing.
Why not?
Exactly. So, the other thing is, you asked me a question about something robotic and all that.
Yeah.
Look. So, don't confuse it with robotic surgery for knees or robotic surgery, for something else. Okay, those are totally different things. Now, here, when anybody can call any machine a robot. Okay, so phone can also be, by the way, a robot, okay, in a way. Okay, so, but truly speaking, what people call robots is certain machines which claim that they can do extraction of hairs. Okay, as you would know, every machine is as good as the person who's operating it. Okay, so there is no machine in the world which can work on its own and do a fantastic job that a doctor is supposed to do. Even in a robotic surgery of the knee, for example, okay, it is at the end of the day a doctor operating the machine, which is what does the procedure. So these robotic procedures used to be very much in vogue till 3, 4, 5 years back. Okay, there was a period of 4, 5 years when a lot of people used to talk about it. Now it has become more or less some, it's been written off. People are more comfortable giving their head in the hands of an experienced surgeon rather than putting their head under a machine, okay, where they do not know, if the needle is going to go in, how deep it is going to go in. I would be very skeptical doing that. And now I think it's more or less history, that thing. So people understand that it is the skill of a highly qualified and highly experienced surgeon that really matters. It is not a robot which can replace a doctor.
Also, if I may, Natalia, I mean, going a little bit in detail about the robot, I wouldn't really name the robot or the company, but the most advanced one, basically, the only thing it does is it creates excision in the donor area from where an assistant or a technician has to go and plug the hair, and the most advanced one basically again makes slits. So taking out the hair, designing to ensure which grafts to be put where, it is all done by the surgeon. So even in the most advanced robot, it's always the doctors, the surgeons, which is the most important person.
Yeah.
And also talking in terms of the sessions happening in Turkey, we have to understand that hair transplant is not the end point, it is merely the beginning of the journey, because the journey begins with the implanted hairs growing better and creating a transformation, for which follow-up and post-op care and treatment is also equally important. Many people who go to Turkey, they don't understand that once you come back, there is hardly any follow-up or aftercare which has to be taken care. And that is again where we excel compared to the other countries, because we have a set protocol of post-op care, which is practiced meticulously, which actually is actually the X factor when it comes to our success.
There is significant clinic in Turkey also. We don't say Turkish hair transplantations something wrong about them,
No, no, no,
but the problem
nothing.
with robotic salons without
Yes,
doctors, that is a problem, and people
yes.
don't know about. And what is, from patient perspective, what is your suggestion? What to pay attention where they consider which clinic to choose? Give
Yeah.
a
Oh, that's a very important question, Natalia, and a very serious one. Because there are many doctors and clinics, who are expert in doing marketing, and there are people who will use celebrity endorsements to promote their work. When you go to the clinic, the doctor is sitting there, very impressive doctor, and he's doing the counseling of the patients. Okay, everything is so far so good, but when it comes to actually doing the procedure, you again land up in the same situation where you have 3, 4 technicians, okay, who are doing the hair transplant, and the doctor is just, maybe comes in for 5 minutes to just say hello to you. This is I personally think that this is unethical situation. Okay, in DHI, for example, our doctors who are dermatologists, plastic surgeons, they will not let any non-doctor to touch the patient. Okay, entire procedure in DHI is done by the doctor himself. Dr. Kuntal, he is our medical director, and he just finished a surgery. After which we are doing this, Insta live. But it is a taxing procedure. So I would advise that, first of all, you go and meet and do the counseling with the doctor, any clinic, but you ask them who is actually going to do the procedure. Okay, and is that person the only one who is going to touch me, or is it, because the doctor may say that, I will do it, but he's not really going to do it. He's just going to come there for a few minutes. Okay, so be aware of this thing. Don't be taken in by a doctor's sales skills or by marketing skills of a clinic. Look at the genuineness of what procedures they have. Where did the doctor do his training from? How many years of experience does he have as a hair transplant doctor? Because there are many doctors with 20 years of experience, but they started doing hair transplants only 4 years back. Okay, so there is a huge difference there, and ask. I would say patients should ask a question. Once you've done the work, is somebody going to check on your work? Is there somebody who's going to check your work? Because if there is nobody to review what you are doing, then you end up doing whatever you feel like. Okay. Do you have any protocols? Okay. Do you have any written protocols that you follow while doing the procedure? So I would say these are some of the things. Do you have any safety protocols, for example? You can go to the to the OT room. Outside that, you just see, is there any checklist which takes care of the patient's safety and so on. So just be very vigilant while choosing the hair transplant clinic, because it is a matter of your look or your confidence, and in some cases, unfortunately, it can be your safety as well.
I see. Thank you. Good tips, Dr. Bansal. And my next question to Dr. Kuntal. And let's speak more deeply about DHI services. And
Yes.
what are the medical conditions you consider while choosing the patient for hair transplantation? For example, some patients have doubt. I have diabetes. I don't want to go.
Yeah.
It doesn't work. Something like that. So please tell us about
Yes.
this more.
First and foremost, we should understand that anyone suffering from hair loss, not all cases are fit for hair transplant. There will be females, especially, who are suffering from something known as telogen effluvium, which can happen after childbirth, after surgery, or anything like that. So that is something where the person is losing hair in lumps. So that is not really a case of hair transplant. There may also be scarring alopecia, where there is scarring in the scalp, which is basically an autoimmune condition. And these are cases which are not fit for hair transplant. Now, coming to cases which are fit for hair transplant, broader category, in males, it is known as androgenic alopecia, and in female counterpart, it is known as female pattern hair loss. So in these cases, again, in females, we have to ensure they don't have any hormonal imbalance, they don't have any iron deficiency, thyroid deficiency, etc. If they do have it, we correct it, and only then we go for hair transplant. In males, like I had already mentioned before, if anyone is hypertensive, anyone is diabetic, we ensure we also have a medical board which analyzes those patients. We ensure that their blood sugar levels, their blood pressure is absolutely normal. We keep a log and track their glycosylated hemoglobin, their actual fasting blood sugar, as well as their blood pressure almost on a daily basis. Once we know that everything is under control and they are also given a go ahead from their respective treating surgeons or cardiologists, only then we proceed for a surgery with DHI. And even after that, we keep a track of their parameters even after the procedure for at least a couple of weeks. So everything, right from pre-op to post-op, we ensure everything goes off smoothly.
I see. We already said don't mix holidays with hair transplantation. So please tell us more about all this process. What happens after the operation? How long should person stay in clinic, or how many
Okay.
days he should stay? How many times he has to come
Okay.
to visit the doctor after transplantations? And when he can go home?
Right. So hair transplant per se is more of a minimally invasive procedure than a proper surgery. And even in terms of hair transplant, DHI is the least invasive because we use implanters, we don't create slits, etc. So post surgery, the person goes back home. He has a light bandage at the back of his scalp from where the extraction is done. The implanted area in the front or in the mid zone is left as it is. He can come back the next day, the bandage gets removed, and then he just has to keep spraying saline for the next couple of days. And after 3 days, that area is washed, and then he's as good to go. He's good to go and resume his day-to-day activities. We have had patients flying from abroad, from the US, from UK, and other parts of Europe. they can go back home in the next 3-4 days post-transplant. They can resume gymming or the work in, I would say, around 7 days' time. People nowadays who are working from home, they actually can resume work the next day itself because they don't suffer any kind of pain. The chances of infection is 0.00001%. Anyways, they are on antibiotics for the next 5 days. So no pain, absolutely no swelling, nothing at all. They can resume their work. I mean, I myself got a hair transplant done, and I actually drove back home that day. Not that I'm encouraging people to do that, but that's how safe it is. You know, it's absolutely safe procedure per se.
It's important when doctor have hair transplant surgeon has a hair because
Yes,
normal it's like situation with ophthalmologists. They
yes,
say to do LASIK
exactly.
operation and sitting in the glasses.
Yeah. So I'm myself my biggest advocate. You know, I show my hair that, can you believe that I actually myself have got a hair transplant? See how thick it is. So it's easy for them to get convinced that way as well.
Good. And also, please tell us more about techniques of eyebrow transplantations. I know a lot of women, especially,
Yes.
they would like to have it.
Yes,
What can
yes.
you
So
offer them?
eyebrow transplantation is a common procedure, especially among women, because they are conscious if they lose their eyebrows or they become thin. So in those cases, we take hair only from the specific areas. We take the thinnest possible hair, which is from the nape of the neck or from behind the ear. The punch, the instrument which is used to extract the hair, we use the narrowest possible, which is somewhere around zero point 0.7 millimeter. So the hair that comes out is very thin. And we use a specific patented instrument known as the implanter. So the best part about implanter is it gives us absolute control over the angle and direction. As you know, in eyebrow, the angle of the hair, the direction of the hair is very important. So using the implanter, we have 100% control over which hair follicle graft, whether it is a single or the double, how to implant, which direction to implant. And even after implanting, we can maneuver it to ensure that it is in the best position from where the hair grows and makes it look natural. So we have had multiple cases. We do it almost on a monthly basis, and many of them are, if not every one of them, is very, very happy with the eyebrow transplant results.
So, and they go out from the clinic with eyebrow and everything okay, correct?
Yes, 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 yes. You can see the results, and they're happy to see the hair instantly because they can see the hairs growing in maybe say around 7 days' time. So the
Mhm.
happiness and the delight is even faster compared to a hair transplant in eyebrow cases.
Good, good. So, and my questions to Mr. Bansal, what is the main services of that DHI International provides to foreign clients as we are a platform for medical tourism? So we're speaking about foreign clients who can come from Europe, from CIS countries, from USA, to India or to other countries that you are operating. And tell us more about how do you ensure international patients feel cared for during their treatment journey?
Okay. So DHI is known to be the gold standard in hair transplant. That's what we really do very, very well. That's our forte. So the main service that we provide to international clients, or what they come to us for, is hair transplants, of course, and to get permanent results. And we do beard transplants also, by the way. So these are the treatments that we do normally for them. A lot of people nowadays want facial hair as well, and they don't have too many hairs on the face. So these treatments are typically what people are seeking from us when they are coming to us from countries like USA, Canada, Europe, Australia, and so on. Um, uh, See, you asked, the second part of your question was, how do we make them feel cared for? Am I right?
Yes, yes.
Yeah. Yeah, every patient for us is a VIP, by the way. Okay, whether it is a local patient, whether it is an international patient, at the end of the day, patient care and satisfaction is our number one priority. That's what we really work for all the time. For international patients, most important thing, and which they will miss in many other clinics, is the follow-ups after they go back. Okay, are they being followed up on over the next few months till the journey of their hair growth actually culminates? And that's really the main thing for them. So, we have a protocol for periodically doing video calls with them, taking pictures of their growth, hair growth, till they achieve their final result, which can happen over a period of 9, 10 months to, let's say, 12 to 15 months in some cases. And we make sure that they do reach those results, which is why now we have a referral network coming from our international patients also. They are sending us patients from their own families and friends from all these countries. Okay, so by the way, half of our business comes through referral network, and not only locally but also internationally. People are sending patients from their family and friends networks. So yeah, patient care is the most important thing. International patients are very special because they took great pains to actually come to us. So we take some extra care for them.
Thank you. And we have questions in our chat, and also I would like to make it to answer more wider and to tell us about steps. So question is, how do I know am I a right candidate for hair transplant? So please tell us about steps. Patient have a question, patient contact you, what next?
So ideally, the patient comes to us for a consultation in any of our clinics, wherein the consultant doctors, they
Sorry, interrupt you. International patients come
yeah,
just
okay. So, yeah, right. So in terms of international,
yes,
yeah, I understand.
yes.
In terms of international patients, yeah, of course, we do align a video consultation where either of our surgeons or any of our senior consultants first interacts with them, goes for a consultation. We take the medical history. We ask them for how long they have been having this hair loss. We ask if they have any other medical complications. We give them specific instructions about how to take pictures and how to evaluate the or self-evaluate the donor itself, because again, the quantity and the quality of donor is very important when it comes to a successful hair transplant. So once everything is set, based on their requirement or what stage of androgenic alopecia they are suffering from, we show them pictures of patients who were like them and their happy transformation. We can even align for direct interaction with any of our happy patients, who then gives their feedback, gives them the confidence. And once everything is set, then the date and everything is finalized for the hair transfer, the travel and everything is taken care of by the organization. That's how it's done usually.
Do they send some report to you or not in
Yes,
advance?
most of the because we have a set protocol of the blood tests and everything that needs to be done. We ask them to get it done locally, and once they give the reports to us online or a PDF format, then once everything is set, then of course they are aligned for the transplant.
But please answer on questions. This: how do I know am I right candidate for hair transplant? What do you do? For example,
Again,
if this lady was asking, lady.
okay. If a lady was asking, then we have to understand one very important thing, that the causes of hair loss in a female is very complex when it concerns them. They can have iron deficiency, anemia, which is low hemoglobin along with low iron levels. They can have multiple hormonal imbalances. They could be suffering from a condition known as polycystic ovarian syndrome, which is a very common syndrome associated with hair loss. They could be having hypothyroidism. So all of these actually leads towards hair loss. And also females in the perimenopausal age, in the mid 40s or late 40s, they are also prone to hair loss. So we have to first ensure that all of these criteria, the nutritional deficiencies, the hormonal deficiencies, everything has to be corrected. They can check with a physician locally, get that corrected. Once everything is set, and then, of course, the next step is to go for a hair transplantation. But a hair transplantation will not be successful until unless the predisposing factors are first taken care of. So that is something we ensure that the person knows properly and beforehand. and then we go for the hair transplant.
Thank you.
I
And
would say, Natalia, I would say a simple answer to this also, another way would be when in doubt, do a consultation with our experts. Okay, let them take over the process from there, and you don't have to really decide whether you are a hair transplant candidate or not. If you are having hair loss and your hair loss is bothering you, you consult us, and we will advise you which tests, medical tests to be done, and the journey starts from there on. Okay, and each patient is unique. Each patient may have a unique treatment plan, so let us take over from there.
do all women need to shave hair before transplantation?
No. They don't need to. We just trim a small area, say around a couple of centimeters at the back of the scalp, which anyways is concealed with their long hair. And again, the USP of using an implanter is that we can implant in between existing hair because we are using this kind of like thing wherein the person does not need to shave for the implantation to be done. That again is the beauty of the DHI procedure.
Good, good. So thank you very much for this discussion, and we have no any other questions. And I hope and I wish you to be a winner this year. This year award ceremony will be in Romania in June, and I hope you will come in person to this event, and we again will celebrate your success.
Thank you very much,
Thank you.
Natalia.
Thank
Thank you
you.
for having us.
Bye.
Thank you so much. Thank
Bye
you.
bye.
Bye. Bye.